At TrialNet, we're working to understand the development of type 1 diabetes and find ways to preserve insulin production by beta cells. These efforts, in collaboration with you, will move us closer to a world without type 1 diabetes. I'm Dr. Daniel Moore, co-chair of the TrialNet Reset T1D Study and a principal investigator and pediatric endocrinologist at Vanderbilt University Medical Center. TrialNet is conducting this study to learn whether a medication called Rezpegaldesleukin, or just Rezpeg for short, may help lessen the immune attack and preserve beta cells in people who have recently been diagnosed with type 1 diabetes. If you were diagnosed with type 1 diabetes within the last 3 months, you may be able to take part in the Reset T1D study. Why do we want to study Rezpeg? Many don't realize that most people who are newly diagnosed with type 1 diabetes still have some beta cells that continue to make insulin. People who continue to make even a small amount of insulin often find it easier to manage their blood sugar levels, including avoiding low blood sugar. Making even small amounts of your own insulin may also help reduce the risk of long-term complications. Rezpeg works by supporting a type of immune cell called regulatory T cells, or Tregs, which normally help prevent your immune system from hurting your own tissues. When these Tregs are not effective, autoimmune diseases like T1D can result. The Reset T1D study will take a closer look at the role of these Tregs to see whether increasing them helps protect beta cells in people with type 1 diabetes. This is the first time that Rezpeg is being studied in people with type 1 diabetes. To start, the study will include adults ages 18 to 45, with plans to include younger participants in the future. This is a placebo-controlled study. That means that some participants will receive the study drug Rezpeg, and others will receive a placebo, which is an injection that is meant to look like the study drug but does not contain any medication. Participants are assigned randomly by a computer to receive either Rezpeg or the placebo. Participants will be in the study for 1 year. During the first 6 months, participants will get an injection about every 2 weeks for a total of 15 injections. After the treatment phase, participants will have 3 more study visits during the last 6 months. Participants are closely monitored by experienced TrialNet research teams throughout the study. If you are interested in learning more about the Reset T1D study, we encourage you to fill out the interest form on the website or contact your closest TrialNet location. Each clinical trial helps move type 1 diabetes research forward. Thank you for taking the time to learn about this study. Visit trialnet.org to learn more about Reset T1D.